interesting topics, and I was kind of afraid that I might put you guys to sleep. But anyway, I'll do my best to make it interesting. So I'm going to talk about prevalence of depression and factors influencing it among the geriatric population attending the outpatient services of a tertiary care hospital. Again, I'm Dr.A K Prashanth. I'm the principal investigator of this study. I'm from PhD Institute of Medical Science and Research, Coimbatore. These are my co-authors. So let's have a kickstart to the introduction. Now, to put in layman's term, what is depression? Can anyone tell me what is depression? Yeah. Putting it simply, it's that. It's like it's the feeling of sad, miserable, and down in the dumps. It's a state where it leads to increased morbidity and mortality, and also it leads to suicidal tendencies, and also predisposed to other lifestyle induced diseases like diabetes, hypertension, and so on. Now, studies have shown that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Now, in our brain, we have lots of neurons. It's the basic structure of nervous tissue. In between the neurons, there are junctions called as synapses. Now, any communication in our brain happens by a transfer of electrical signals and chemicals between these nerve junctions. Now, we have excitatory transmitters and inhibitory transmitters. Excitatory transmitters basically, simply makes us happy. Sometimes if it's pathological, it makes us hyper. But those are responsible for a good state. And there are inhibitory neurons. Normally, there's a balance between the excitatory and the inhibitory neurons. Now, so depression is basically a condition in which the inhibitory transmitters are very high, where inhibitory transmitters are uninhibited. You could put it that way. So there are several scales that are used to quantify and measure depression. To name a few, they are the Hamilton Depression Rating Scale, Beck's Depression Inventory, the Geriatric Depression Scale, and several others. So, what is of interest to us is the geriatric depression scale. Now, it is used in elderly patients and for patients with mild among these people. So, methodology, my study is basically an observational study. Elderly patients above the age of 60 years attending the outpatient services of PHC hospitals were considered. Patients with known psychiatric conditions like schizophrenia or any other psychiatric conditions were excluded from the study. So the geriatric depression scale short form, which is also called GDS-15, was used to assess depression, and a self-designed questionnaire was used. Now, this questionnaire was prepared using community medicine experts with possible factors that would probably lead to depression. And we only focused on factors which were actually not analyzed properly in previously published literature. So, an informed consent was obtained from all the patients, and a detailed one-to-one interview was conducted. So, what we didn't do is we didn't simply go to the OP and ask patients questions. We explained the patients about the study. We got them separately to a calm and isolated location, and we had a one-to-one interview. It was a detailed interview, and the results were tabulated and analyzed using GDS-15, the questionnaire, and statistical tools. Now, this is the example of the geriatric depression scale short form. Now, this scale is already an established one. It has been published in various studies and is an established scale to assess depression. Those are p-values. It was calculated using the student's p-test. Yeah, exactly. It's that it was not obtained by chance. That has a definite relation. You want me to go? Yeah. I'm not like, putting in a general statement. It's from a published literature which shows that, depression causes reduced quality of life, leads to increased suicidal tendencies and so on. Yeah. You want me to? Yeah, true, true. Hmm. True. It does. See, I would say, see, we, due to time constraints and all that, we have a busy practice too. So we could only take 51 subjects. So one way to address that issue, that is actually what we call that is bias. So that is called a bias. So one way I feel to address that condition is to increase the sample space. See, mine is a small study. Yeah, and generally for for studies which need to show prevalence and all that, we need to have samples in hundreds, maybe thousands too. So that would be one way to address that particular thing. But this is just a pilot study. It probably shows yes, this is not the first study of science. See, there are lots of studies. Yeah, yeah. The thing is, like, a similar study might be done in Chennai itself, but a simple geographic variation between two cities can also make a difference. So that's why it still makes a difference.
Think building on top of what you said, try to make your score more by having a weight
But this geriatric depression scale is a universally accepted scale mild and moderate dementia. See, dementia is a condition in which most people of old age have some degree of dementia. So, like give you an example, a patient is coming to OP to visit the cardiology OP. He's going to go and